So I'm here to just briefly talk with you about Brandon and his needs. So Brandon has cochlear implants in both of his ears. So a cochlear implant is a surgically implanted device that sends sound signals to Brandon's brain. So what this means for Brandon, before his cochlear implants, Brandon had a profound hearing loss in both ears. After his cochlear implants, his hearing is technically in the normal range, but that doesn't mean that he hears normally. Hearing with a cochlear implant is much different. A cochlear implant is an electrical device, so speech sounds very mechanical. And I'm going to play just 5 seconds of what it sounds like to hear with a cochlear implant.
What kind of bait do you use to catch salmon?
So as you can tell, that's very different from normal hearing. So it's going to impact Brandon's ability to perform in the academic environment. He's going to have more difficulty hearing what you're saying than hearing what peers are saying. He's also going to have more difficulty communicating with you and peers because his hearing loss has affected his speech development as well. He's also going to have reading and writing difficulties because he hasn't been able to sound out words like typically developing kids have. So there are some minor but pretty important accommodations that you can make to help Brandon be successful in the school environment. The first thing I'm recommending is that you use an FM system. And what this is, it's pretty simple. So you wear a small microphone, you just clip it to your shirt, Brandon will bring it to you, and Brandon wears a receiver. And this receiver transmits your voice directly into Brandon's cochlear implant. So this really improves the likelihood that he's going to hear what you say and be able to respond to what you say. Some other small accommodations that you can make: get Brandon's attention before you talk to him. Repeat yourself as necessary. Preferential seating will be crucial for Brandon. Sit him in the front of the room, away from noise sources like fans, air conditioners. Try to face Brandon whenever you talk to him. That gives him the visual cues of your lips to be able to read. And really just encourage Brandon to advocate for himself. Really have an open dialogue with him about his needs. Encourage him to tell you when he hasn't heard something or when he feels like something is wrong with his cochlear implant. Let him know that you're on his side, and just try to respond with patience with him as much as you can.